Stroke is the third leading cause of death in this country, and today health reporter Alicia Booth is here with one way to improve your chance of surviving a stroke.
And you know, this information was just released this afternoon, and it's good news for us here in Northeast Ohio. It's a study from Duke University which shows you have a better chance of survival if you are admitted to a primary stroke center, and we have several here. Just before Christmas, Carol Schwendemann's life changed dramatically when she realized her worst fear.
The one thing she's always said in life is that she never wanted to have a stroke and be trapped inside her body, and that if that would occur, just to put her away somewhere and walk away and continue on with our lives.
But Mrs. Schwendemann and her family are fighters, and they say Metro Health Medical Center is helping them win this fight.
They've done amazing things with her.
Metro is just one of about 700 hospitals in the whole country designated a stroke center, one of several in the area. But locally, the co-director of the stroke program here tells us ambulances come to Metro about 60% of the time.
And they know that if they have a potential stroke, they'll contact us before the patient even arrives. We'll have the room ready set up, we'll have the CT cleared before the patient even arrives.
Stroke centers like Metro's are what the authors put to the test in research just published in the Journal of the American Medical Association. It showed people like Mrs. Schwendemann have a slightly better chance of surviving an ischemic stroke if they are treated at a designated stroke center.
Basically a hospital-integrated approach to treating stroke that starts in the emergency department but lasts throughout the entire hospitalization.
It's an option Mrs. Schwendemann's family is grateful to have.
They've nurtured us as well as her through the whole process, and I don't think she would be as far as she is today if she hadn't been life-flighted here.
Duke researchers also say stroke patients who live farther away from designated stroke centers only have a 25% chance of getting to a center like that for treatment. Mrs. Schwendemann lives in Burton and was flown by helicopter to Metro for treatment. But regardless of where you live, getting treatment as quickly as possible is key.
And access to air ambulances like Metro's Life Flight is so important, especially considering that almost half of Americans live more than an hour away from a primary stroke center.
That's so true. And even if you can't get to a primary stroke center, if you think you are having a stroke, don't mess around. Call 911 right away because you've only got about a 3-hour window to get medication for it.
It's a big, big difference. Thanks, Alicia.